In 1859, a respectable London woman named Miss Whitmore visited her doctor with a worrying list of symptoms. She suffered from persistent anxiety, chronic insomnia, uncontrollable irritability, and what she delicately called nervous episodes. The doctor, following what at the time was considered the best available medical practice, promptly diagnosed her with hysteria, a condition believed to afflict millions of women throughout the Western world. He then prescribed a treatment that today would immediately result in the revocation of any professional's medical license by any ethics committee. The doctor conducted what was clinically defined as manual pelvic therapy, stimulating the patient's genital areas until she reached what he noted in his clinical records as hysterical paroxysm, characterized by involuntary muscle contractions and an evident subsequent state of relaxation. This was not some charlatan operating in a disreputable alley or an unqualified practitioner. It was a standard medical procedure, regularly performed by respected and qualified doctors in the finest private clinics of Europe and America. These professionals had studied at the most prestigious universities, published articles in respectable medical journals, and enjoyed the complete trust of respectable society of the era. For over 2,000 years, successive generations of doctors in different cultures had diagnosed and treated women for what they called hysteria. It was an extraordinarily versatile medical diagnosis, a sort of universal container that could be applied to practically any symptom or female behavior that did not conform to the social expectations of the time. This mysterious condition was believed to originate from a uterus that wandered inside the female body. In the Victorian era of the 19th century, this ancient treatment had evolved into something that today would seem absolutely bizarre and completely inappropriate. Doctors literally provided women with what we today clearly recognize as sexual stimulation to the point of orgasm, presenting it as legitimate and necessary medical therapy, apparently without having the slightest conscious idea of what they were actually doing from a physiological standpoint. This is the true and astonishing story of how Victorian sexual repression was so total, so profound, and so pervasive in every aspect of society that doctors eventually invented the first mechanical and electric vibrators primarily to spare their own sore and fatigued hands the physical labor of manually treating hundreds of patients considered hysterical women, while remaining completely and genuinely unaware of the true sexual nature of what they were administering. But before delving into the historical details of how Victorian doctors transformed this ancient Greek medical superstition into a thriving and profitable sector of the modern medical industry, it is important to understand the deep historical roots of this extraordinary story that spans millennia of medical history. The medical concept of female hysteria dates back to the ancient Egyptians, but it was the celebrated Greek physician Hippocrates, considered the father of Western medicine, who gave this supposed disease its formal name that would last for centuries. The word hysteria derives from the Greek term hystera, which literally means uterus. Ancient physicians firmly believed that women's uteruses were not fixed organs in their anatomical position, but could literally wander and move freely through the female body, causing a bewildering variety of physical and mental symptoms. The philosopher Plato described the uterus in almost mystical terms as a living animal inside another animal, a separate being with its own desires and needs, desperately eager to procreate and generate new life. According to this ancient medical theory, if a woman remained too long without marrying, without having regular sexual relations, or without becoming pregnant and bearing children, her frustrated and unsatisfied uterus would begin to restlessly move through her body in search of satisfaction. This wandering uterus, according to ancient physicians, pressed on other internal organs during its wandering, causing all sorts of health problems. Symptoms attributed to this phenomenon included paralyzing anxiety, sudden fainting, shortness of breath, heart palpitations, general weakness, and various emotional disturbances. The medical cure prescribed by ancient Greek and Roman doctors was simple and direct: immediate marriage and prompt pregnancy, to finally satisfy the restless reproductive organ and return it to its correct position. During the European Renaissance period, more enlightened physicians gradually abandoned the fanciful theory of the wandering uterus as an anatomical explanation, recognizing that internal organs are fixed in their position by ligaments and connective tissues. However, they stubbornly maintained the diagnosis itself of hysteria as a legitimate medical category, simply modifying the theoretical explanations for its cause. The symptoms attributed to hysteria progressively expanded over the centuries to include practically anything that could disturb, worry, or make a woman unhappy. The growing list included chronic nervousness, persistent insomnia, involuntary muscle spasms, shortness of breath and breathing difficulties, complete loss of appetite, constant irritability, profound depression, behavior considered sexually too open and available, behavior considered sexually too repressed and cold, and especially the dangerous female tendency to create problems, ask uncomfortable questions, or challenge male authority. In practice, if a woman was not perfectly submissive, docile, obedient, contentedly happy with her subordinate condition, and completely satisfied with her limited domestic role, she was probably considered hysterical by the doctors of the era. The respected English physician Thomas Sydenham estimated in the 17th century that hysteria was the most common disease among women after infectious fevers, affecting at least 1/4 of all adult women at any given time. Victorian medical theory of the 19th century maintained with great conviction that women were by their very biological nature intrinsically more delicate, fragile, and nervous than robust men. Their reproductive system, according to these doctors, completely dominated and controlled the entire female physiology, making them naturally prone to both mental and physical weakness. Women were essentially seen as prisoners of their reproductive biology. The noted and influential Victorian physician Dr. William Acton wrote categorically in his medical treatise of 1857 that the great majority of women, fortunately for them and for society, were not very troubled or disturbed by any kind of sexual feeling or desire. This deeply rooted cultural belief that respectable women of good family simply did not experience natural sexual desires created an enormous and dangerous blind spot in the medical practice of the era. Thus, when women regularly presented themselves in medical offices with symptoms that today we would clearly recognize as sexual frustration, accumulated tension, and need for physical release, even though neither doctor nor patient would ever explicitly use that direct terminology, male doctors saw only a mysterious physical illness requiring clinical treatment. They could not or would not see the obvious truth that was literally before their eyes. The standard treatment that gradually developed during the 19th century was what was prudishly called therapeutic pelvic massage to artificially induce the so-called hysterical paroxysm, what today we immediately and unequivocally recognize as sexual orgasm. But Victorian doctors described it exclusively in purely clinical and medical terms, without any recognition of its evident sexual nature. Dr. Nathaniel Highmore wrote as early as 1660 that this particular medical treatment provoked in the woman affected by hysteria a series of violent, rhythmic, and involuntary muscle contractions and relaxations, accompanied by evident and dramatic flushing of the face and neck, an increase in respiratory and heart rate, and finally a profound sensation of immediate relief from previously complained symptoms. Here is how this medical treatment worked concretely and practically in the daily reality of Victorian medical offices. The woman regularly visited her doctor's private office, often with fixed weekly or bi-weekly appointments that could continue for months or even years. She would lie on the medical examination table, partially undressed in the lower part of the body to allow necessary access, but decorously covered with a clean white sheet to preserve the modesty considered essential. The doctor generously applied perfumed and lubricating oils, usually based on delicate lavender or rose essence, both to facilitate the massage and to create a pleasant clinical atmosphere. He would then methodically begin to massage the external vulvar area with regular and rhythmic circular movements, following techniques described in detail in specialized medical manuals of the era that circulated among professionals. The manuals and medical treatises explicitly recommended patiently continuing manual stimulation until the patient reached what they called the therapeutic paroxysm, described clinically in texts as a series of sudden involuntary muscle contractions in the pelvic region, visibly flushed skin on the face and chest, dramatic increase in natural vaginal lubrication, accelerated and deep breathing, immediately followed by a state of profound physical and mental relaxation. Dr. Russell Thacher Trall wrote in his influential medical treatise of 1903 that successfully obtaining complete hysterical paroxysm in some particularly difficult or resistant patients could easily require more than a full hour of continuous and fatiguing manual stimulation, and openly complained that it was undoubtedly the most boring, repetitive, physically exhausting, and frankly unrewarding medical procedure that a doctor could be called upon to perform regularly. Victorian doctors genuinely considered this treatment an ungrateful and unpleasant job. In their minds, completely conditioned by the cultural conventions of the era, it had absolutely nothing sexual or erotic about it. They were simply professionally inducing a beneficial therapeutic medical crisis to temporarily alleviate the physical and mental symptoms of their suffering patients. It was a clinical act for them as much as manually reducing a bone fracture or draining an infected abscess. An anonymous doctor wrote candidly in a preserved private letter that regularly treating numerous hysterical patients was truly physically hard and mentally boring work for the poor physician, typically requiring from 1 to 1.5 hours of his precious professional time for each single patient, time he would have preferred to dedicate to more interesting and intellectually stimulating medical cases. The treatment of hysteria through pelvic massage was extraordinarily common and widespread throughout middle and upper-class Victorian society. By the end of the 19th century, conservative medical estimates suggested that up to 75% of all adult American women suffered at some point in their lives from symptoms classified as hysteria requiring some form of medical intervention. In large European and American cities, some particularly entrepreneurial doctors specialized exclusively and profitably in the treatment of female hysteria, visiting and treating dozens of women patients every single working day. Dr. Charles Taylor's private medical office in New York City openly and proudly advertised in respectable magazines his complete guaranteed relief from nervous exhaustion and all common female disorders, and steadily employed multiple assistant physicians to cope with the enormous, constant demand for treatments. The detailed appointment booking records preserved from that era clearly show that women scheduled regular weekly or bi-weekly treatment sessions for hysteria, often continuing faithfully for many consecutive years without interruption. Some particularly faithful patients maintained regular appointments for a decade or more, becoming practically permanent clients. Not all treatments for hysteria necessarily occurred in traditional private medical offices. Particularly wealthy and affluent women of the upper classes could afford to receive comfortable home medical visits, where the doctor would come directly to their private residence with his medical bag containing necessary oils and instruments. But the most popular and socially acceptable alternative solution was represented by specialized hydrotherapy practiced in dedicated spa clinics. The so-called water cure fundamentally consisted of directing powerful high-pressure water jets directly onto the external female genitals, while patients sat comfortably on special chairs specifically designed and constructed for this specific therapeutic purpose. The famous European spa resorts, such as Elegant Bath in England and renowned Baden-Baden in Germany, rapidly became celebrated throughout Europe precisely for their specialized and effective treatments against female hysteria. Wealthy women spent entire weeks of therapeutic stays there, regularly taking the healing waters and receiving multiple specialized hydrotherapy treatments every single day, according to rigorous medical programs. Scholar Rachel Maines, in her pioneering and revolutionary academic book titled The Technology of Orgasm, published in the 1990s, meticulously documented through archival research how these popular thermal water treatments concretely worked in practice. Patients sat on special medical chairs with the seat strategically cut out and open in the center, while specialized and trained attendants precisely directed powerful jets of cold or hot water directly onto the external genitals through flexible tubes. In France, they called it by the medical term la douche pelvienne, literally the therapeutic pelvic shower. An enthusiastic advertisement from Baden-Baden of 1875 solemnly promised the complete guaranteed restoration of natural female vitality through the rigorously scientific application of miraculous mineral thermal waters. Women regularly and enthusiastically reported feeling completely reinvigorated, relaxed, happy, and completely restored to health after completing full cycles of hydrotherapy treatment prescribed by spa doctors. They returned home to their families visibly more serene and with notably improved mood, at least temporarily, until symptoms inevitably returned after a few weeks. In the 1880s, English physician Joseph Mortimer Granville had developed a serious and painful professional problem. His right hand was literally cramping from manually treating too many hysterical patients every day. Prolonged manual pelvic massage was physically exhausting and repetitive work, especially considering that some particularly difficult women required more than a full hour of continuous stimulation to finally reach the necessary therapeutic paroxysm. His ingenious solution to this practical problem would inadvertently completely revolutionize the medical treatment of hysteria forever. The invention of the first electromechanical vibrator specifically designed for medical use. Granville's innovative device, technically called an electric percussor, used a small but powerful electric motor to create rapid and constant mechanical vibrations, drastically reducing the average time necessary for treatment from over an hour to just a few efficient minutes. Granville himself publicly and categorically insisted that his ingenious mechanical device served exclusively and solely to treat various muscular disorders in men, such as chronic tensions and painful spasms, and firmly denied any gynecological application. However, other more pragmatic doctors rapidly and enthusiastically adopted it precisely for the treatment of female hysteria, immediately recognizing its enormous practical utility. Within just a decade, literally dozens of different models of mechanical and electric vibrators flooded the specialized medical market. The detailed commercial catalog of the Weiss Company of 1906 proudly offered professional doctors more than 20 completely different models of therapeutic vibrators with various powers, sizes, shapes, and interchangeable accessories for different specific medical applications. Advertising insertions in prestigious professional medical journals openly boasted the revolutionary efficiency of these new electric devices. A typical advertisement proclaimed, "The Chattanooga electric vibrator completely relieves debilitating symptoms of hysteria in less than 10 minutes of application, saving precious time for the busy physician." By the year 1900, electric vibrators had surprisingly become the fifth most common household appliance in middle-class American homes, regularly appearing in commercial home catalogs next to ordinary toasters and practical sewing machines. The famous Sears catalog of 1908 openly advertised a portable home vibrator as a very useful, convenient, and highly satisfying device for regular home use by ladies. Commercial advertisements were extraordinarily explicit in their suggestions, while remaining formally framed in respectable medical and therapeutic terms. A conspicuous advertising insertion of 1910 showed the image of an elegant woman using the vibrator on her own face with the enthusiastic caption, "Vibration is life itself." The hidden secret of the centuries has finally been discovered and revealed in the wonderful force of mechanical vibration. The greatest modern scientists tell us that we owe our daily health and even our very fundamental life force to this wonderful and mysterious natural force. The White Cross electric vibrator brings the purest essence of life directly and conveniently into your private home. But the truly most disconcerting and psychologically fascinating part of this entire historical affair is that apparently none of the subjects involved, neither doctors, nor patients, nor society in general, consciously and explicitly understood the clearly sexual nature of these widespread medical treatments. Qualified doctors wrote detailed and technically precise clinical articles on the controlled induction of hysterical paroxysm in professional medical journals, without ever mentally or verbally connecting it to female sexual orgasm. Why this extraordinary intellectual blindness? The explanation lies in the fact that formal Victorian medical education completely and systematically omitted any serious study of normal female sexuality. Official medical anatomy texts categorically taught medical students that female reproductive organs existed biologically solely and exclusively for the sacred function of procreation, not for personal pleasure. The clitoris, the female organ specifically dedicated to sexual pleasure, was barely mentioned in standard anatomy texts, if ever. Many respected medical anatomy texts simply and summarily labeled it as a small, rudimentary vestigial organ of no particular or important physiological function. Essentially, a useless evolutionary residue, like the appendix. The voluntary and culturally imposed medical ignorance was genuinely astonishing in its scope. Dr. John Harvey Kellogg, yes, the very same man who later invented the famous breakfast cereals that still bear his name today, ran a large and influential sanatorium in Michigan, where he regularly treated hundreds of women for hysteria using the most modern electric vibrators available, while simultaneously and paradoxically making passionate public moral crusades against the terrible danger of masturbation, which he considered a dangerous moral evil and a health threat. He apparently never made the obvious logical connection between these two contradictory aspects of his medical practice. Victorian doctors literally spent their entire working days methodically provoking orgasms in women as routine medical treatment, and then quietly returned home in the evening to their own wives, whom they firmly believed to be completely devoid of any natural sexual desire or capacity. The psychological cognitive dissonance required to maintain this mental dual reality is truly astonishing. Some more perceptive women clearly understood what was really happening during these medical treatments, even though they absolutely could not say so openly in such a repressive society. Private diaries and personal letters from the era preserved in historical archives occasionally subtly let glimpse the unspoken truth. An anonymous woman wrote candidly in her personal diary of 1892, "My regular weekly medical appointments with Dr. Harrison have completely restored my mood and spirit. I find myself looking forward with great, joyful anticipation to Thursday afternoons." Another woman significantly noted in her diary, "The medical treatment, though certainly singular and unusual in its nature, provides a type of profound relief completely different from any medicinal tonic or traditional medicine I have ever tried before." Women discreetly recommended particularly skilled doctors among trusted friends, creating informal social networks of patients who all secretly received the same identical beneficial treatment. The systematic blindness of the official medical establishment about normal female sexuality had serious and harmful consequences that went well beyond the relatively innocuous treatment of hysteria. Some doctors surgically performed complete clitoridectomies, the total surgical removal of the clitoris, specifically to cure female masturbation, considered pathological. Others brutally cauterized the clitoris with corrosive acids to prevent what they called sexual self-abuse. Dr. Isaac Baker Brown, who was even president of the prestigious Medical Society of London, surgically removed the clitoris from young patients, even as young as 10 years of age, to cure supposed cases of early hysteria. He was eventually expelled from the professional medical society, but significantly only because he regularly operated without obtaining appropriate informed consent from parents, not because the mutilating surgical procedure itself was considered medically or ethically questionable. Meanwhile, the medical hysteria industry continued to flourish economically. In 1915, American doctors collectively earned approximately $18 million per year specifically from hysteria treatments, a sum equivalent to over $450 million in today's monetary value. Specialized manufacturers created increasingly elaborate, complex, and expensive vibrator devices to satisfy the growing medical demand. The Vibratile model of 1908 had multiple interchangeable accessories to treat various specific female disorders. The Pulsocon model, with manual crank of 1890, promised effective therapeutic relief without requiring expensive electricity. Some particularly elaborate devices were even permanently integrated into medical furniture, creating special treatment armchairs with sophisticated vibrating mechanisms incorporated directly into the structure. The gradual end of this medical practice paradoxically began with Sigmund Freud. While having deeply flawed and problematic psychological theories on many aspects, Freud at least publicly and clearly recognized that women naturally possessed legitimate sexual desires exactly like men. He also recognized that many of the symptoms attributed to hysteria often had deep psychological causes rather than physical or organic origins in the body. In the 1920s, the American Psychiatric Association finally began to progressively abandon hysteria as a legitimate and scientifically valid medical diagnosis. But the true definitive death blow to the practice came ironically from a completely unexpected and scandalous source: early pornographic films. In the emerging 1920s, the first illegal pornographic films, called stag films, began to circulate clandestinely, explicitly showing women using vibrators for clearly and unequivocally sexual rather than therapeutic purposes. Suddenly and dramatically, the respectable medical device that had been openly advertised in completely respectable magazines for decades became socially associated with explicit sexuality and pornography. Vibrators disappeared almost literally overnight from respectable medical offices throughout America and Europe. The Sears catalog completely eliminated them by 1925. What had been a common and socially accepted medical treatment for generations suddenly became an embarrassing taboo that nobody talked about. Doctors silently and discreetly abandoned the practice of pelvic massage without making public announcements, and vibrators that gathered forgotten dust in medical closets were eliminated and thrown away. The formal diagnosis of hysteria officially disappeared from standard medical texts in 1952, but its harmful cultural legacy persisted for decades. Women who reported legitimate medical problems continued to be regularly dismissed by male doctors as simply hysterical or overly emotional. The term essentially became a convenient way to systematically diminish and invalidate genuine female medical experiences. Only in the 1960s, with the revolutionary work of pioneering sex researchers like Masters and Johnson, was normal female sexuality finally studied scientifically and adequately. They discovered empirically, through laboratory research, what those Victorian women knew intuitively in their bodies, but absolutely could not say aloud in that repressive society: that the mysterious hysterical paroxysm that doctors had methodically induced for centuries was simply and unequivocally a normal female sexual orgasm. Looking back today at this extraordinary historical affair with 21st century eyes, the entire episode seems almost impossible to believe rationally. How could formally qualified and intelligent doctors not recognize a female orgasm when they deliberately provoked it? How could they repeatedly perform such explicitly sexual acts while genuinely believing they were purely medical and therapeutic? The profound answer lies in the immense power of collective cultural blindness. The absolute systematic Victorian denial of normal female sexuality created a distorted social reality in which doctors could literally provoke orgasms in women for hours every day, without ever consciously recognizing what they were actually doing. This medical history is profoundly important because it demonstrates how completely scientific medical practice can be distorted by unexamined cultural assumptions. These were not incompetent marginal practitioners at all. They were the most respected and qualified doctors of their era, trained in the finest and most prestigious European and American medical schools, who scrupulously followed medical protocols officially accepted by the professional establishment. Yet they were so completely blinded by the total cultural rejection of female sexuality that they literally could not recognize the evident anatomical truth that was under their fingers every single day. The medical treatment of hysteria remains today one of the most bizarre, embarrassing, and instructive chapters of the entire history of Western medicine. If this story moved you, leave a like and subscribe. Share with those who love history. Thank you for listening. See you next time.